Hi everyone, Dr. Remy from Pain Free and Fit. Today we're going to take a bit of a detour from our usual healing exercise descriptions, and we're going to take a look at the overall or big picture of most musculoskeletal pain. We're going to be discussing the two root causes of most pain and the 5 steps of healing you need to take to start getting out of pain and living the pain-free and fit lifestyle. Hope you enjoy. So if you're like me and many of my patients, you may have chronic musculoskeletal pain that has not been helped with traditional passive therapies. Chronic musculoskeletal pain, be it shoulder, ankle, knee, spinal, hip, is many times related to a chronic stress that's being placed on your soft tissues that continues to do damage and aggravates and restarts the inflammatory process. Many of these passive therapies will alleviate pain temporarily, but unless you get to the root cause of these problems, you'll never actually get totally over your pain, and you won't be able to participate in an active lifestyle again. Now, in over 30 years of practice, I'm here to tell you that we have a 93% success rate across the board with all musculoskeletal pain conditions because we help our patients, our students, and our personal training clients find out what the 5 steps are to the healing process. And that's what I want to share with you today. We begin with, first of all, allowing the patient or student or client to understand what their pain is actually stemming from. In most cases, chronic musculoskeletal pain is a result of 2 causes. One, either abnormal body mechanics or postural issues that are abnormally stressing the soft tissues, or 2, a deconditioning where those soft tissues are not strong enough to handle the stresses that are imposed on them. Regardless of whether your pain's history is due to a macro stress, meaning a large stress such as a slip, a fall, a sports injury, car accident, or a micro stress, a more repetitive, smaller nature injury that's built up over time, this same principle occurs. Somehow you're either doing things in your daily habits, your sports activities, your weekly routine that is too much physically for your soft tissues to handle. That could be your way of walking, it could be the way of your movement, it could be the way you're working out. And there's some underlying mechanical principle where soft tissues are being stressed and the healing delicate fibers never get a chance to go through their complete healing mechanism. That healing stimulus becomes aggravated and disjointed every time you put an additional stress on by seemingly innocent habits. There are many patients of mine who are very surprised when I first tell them that their shoulder pain may be related to their torso or their neck posture, or that their lower back disc herniation pain may be related to the way they hold their hip while they walk and the way they bend. Because we all have these unique asymmetries in our body. None of us have a perfect posture or body mechanics that's exactly symmetrical from side to side. Those of us who have injuries many times have worse biomechanics than others. We have these muscle asymmetries that create compression on one side of a joint, overstretching on another. We have force couple abnormalities where joints don't have equal loading from one side to another, and tissues on one side become stressed because they're working too much or compensating for other tissues that are actually weak or inhibited neurologically. So we have to understand what our unique posture and mechanical issues are. The way we get there is we do a full body analysis from the toes through the head and try to determine where those asymmetries in muscle balance, joint stability, and movement patterns are so we can address those with corrective exercises. You also need to understand that there are other factors that go into healing, such as decreasing or eliminating environments that stress your musculoskeletal pain. If you keep doing an activity that every time afterwards it irritates, those have to be eliminated if you ever expect your body's healing process to be able to go forward and mend those damaged tissues. Proper nutrition that helps us to decrease inflammation in the body and help decrease pain sensation is important as well. Of course, also our mental and spiritual outlook on our condition plays a big role. If you have a negative behavior where you will not do your rehabilitative exercises, where you think there's no hope to you and you don't seek out pushing yourself a little bit to find the answer that's been eluding you for a while, you'll never get the answers that you seek. In step 2, what we try to bring across to our patients and clients is we need to teach pain relief exercises. These can be done every day. They're simple maneuvers that help to bring back the homeostasis or balance to soft tissues. Exercises that relieve muscle spasm, that start to recruit inhibited muscles, that take tight joints and help to relax and loosen them. We also need to go into a third phase, which is to resolve scar tissue and fibrosis. After anything's been damaged due to injury, we have some tearing in those soft tissue fibers. The body's mechanical process of dealing with this is called the inflammatory process. It rids itself of damaged tissue and tries to bring in new tissue over the first few days, and over the several weeks and months that follow, new tissue is being laid down and then strengthened to be able to support and replace the damaged tissue. Many times what happens is as these tissues grow, we don't get fibers that grow parallel or in the same alignment as the original tissue. We get fibers that grow crosswise and diagonally to the original damaged fibers, and as a result, we get a scar inside that damaged area that pinches the tiny little blood vessels and nerves called angiofibroblastic proliferation that occurs, and that tugging on those tiny little vessels, those little nerves, cause many times repetitive pain. So there are several soft tissue treatments such as active release technique, myofascial release techniques 1 through 4, transverse friction massage, Graston technique, a bunch of others that help to resolve scar tissue. Sometimes you can do that with targeted stretching on your own. That's targeted to improve your biomechanics as you stretch as opposed to promote abnormal biomechanics as you stretch, or other home measures. Sometimes you need professional help with a soft tissue specialist to help resolve that scar tissue. In the step 4, what we teach is the actual corrective exercises you need, the coordinated ways of holding your body in a correct way to decrease those mechanical stresses on the body, to restore normal biomechanics, to realign and create good posture, proper movement patterns, so the soft tissues that you've injured are no longer irritated with your daily activities, movements, and during your workouts. This brings us into finally stage 5 or step 5, where we condition or strengthen the new proper function of the area, as opposed to most generic exercises which only strengthen the dysfunctional biomechanics, because anytime you work out or do a generic rehab or PT program without truly understanding what your unique mechanical and postural issues are, you'll only be using your old habits to produce the motion. And that will strengthen the soft tissues in a way that will promote the same type of movement patterns, postures, and stability, or instability in many cases, that will promote further damage down the line. And that's why a lot of generic rehab programs fail, and patients and students search other venues to try to get lasting relief. So once you learn the correct movements, the correct postures, the correct way of holding your joints, the way you distribute forces across muscles, so entities such as synergistic dominance, where one muscle is compensating for another, start to resolve, where other biomechanical phenomena such as force couple, altered force couples resolve, and length tension relationships are restored to normal. If you start creating normal biomechanics by a skilled professional or a good program that teaches you how to analyze and correct your mechanics and postural issues, you can then strengthen in that last stage your ability to hold yourself in good posture, to hold good joint stability, which acts in 2 ways that benefits you. Number 1, it decreases the abnormal stresses on your tissues because you're not stressing them anymore with abnormal mechanics that wear and tear tissues out. And number 2, as you're working out, it's actually providing a healing stimulus from the workout to signal the body to repair from the workout after you've progressively increased strength from workout to workout. Those signals of repair that occur from workout to workout actually are the same signals you need to accelerate your body's healing mechanism. So if you're just doing normal rehab exercises or just trying to strengthen something without knowing the normal mechanics, many times you're only going to promote more dysfunction. If you're keeping in mind how to hold your body, how to train it to promote proper muscle balance, how to promote good joint stability, how to promote homeostasis or a nice balanced state with all the soft tissues working in an ideal or optimal function, then you're going to be strengthening those tissues to hold yourself that way, which not only promotes better healing, but also helps you stay out of future problems because you've strengthened your ability to withstand the stresses that come your way. So if you're still suffering from musculoskeletal pain and you've not yet found an answer, I invite you to explore these 5 steps of healing Try to find a good therapist or trainer near you that's educated on these topics. They can help you with a body analysis as well as the corrective exercises, and design for you a program that's customized for your body, your unique problems, your level of conditioning. We have a great program several programs on our Pain Free and Fit website that help hold your hand. They bring you through basic body analysis as well as corrective exercises and help you figure out a customized program for yourself. I hope by enjoying these 5 steps of healing process, you can get through your chronic musculoskeletal pains and start enjoying a pain-free and fit lifestyle.